Hello, everyone. Thank you for joining us today on the topic of grief therapy, a really big topic that lots of people experience, right? And we want to be sure that we are prepared to help our clients as well as we'll get into it a little bit deeper towards the end as far as understanding ourselves as well through this too, because we are human as clinicians and we want to make sure that we have all the great skills to do so. So we do have Miss Jennifer Kimling. Sorry. We have Miss Jennifer Kimling. She has her clinical license. So we're going to learn all the great information on grief therapy from her experience. A little bit about myself. My name is Bonnie. I am here with Agents of Change, here to provide you this continuing education training along with Jennifer. I do have a background in social work, lots of experience with children, families, as well as adults, from foster care to migration, as well as mental health services. So, of course, with all of that, we also experience our clients going through grief, loss, when change happens, right? So, as much as this topic is important for us, we have that experience there as well. Here about Jennifer, as I mentioned, she does hold her clinical license, specifically is a bereavement counselor. She's got lots of experience in this, currently practicing with Choices Healthcare. She does utilize play, art, and music therapy modalities in this behavioral therapy. She's really committed to advanced grief-informed care. So, of course, she's going to be able to give us those really great insights to this experience that she has. So she will be sharing her practical insights from her clinical experience, from mental health professionals that are tuning in today so that we can strengthen our approach in grief therapy when we encounter this in our practice and are working with our clients. So I look forward to you listening in for this hour training. We are ACE approved through ASWB and also NBCC approved. So if you need to get that accreditation through there, you will earn your 1 CE credit for this training today. And we'll go ahead and get started on our topic. So, of course, understanding why this is so important. If Jennifer, you can tell us a little bit about the importance of grief and us understanding this topic.
Sure. Well, firstly, thank you for having me, Bonnie. As you mentioned, every social worker, every mental health professional is going to come across a grieving individual. Whether that's because they've lost someone to death or serious illness, um, or migration issues, every human services professional is going to experience a grieving individual at some point in their career. And so it's essential that we are well trained on how to best support them.
Yes, so thank you so much for giving us insights on this today. With all of your really great experience here, in your clinical work and experience, how do you differentiate normative grief to the prolonged grief disorder, major depressive disorder, as well as PTSD when that comes?
That's a great topic and a great question, right? Because there are things in there that do overlap. And a lot of clinicians often ask that question, how do I know that this is normative grief, right? So, firstly, we never want to pathologize grief. Grief is a process, it's something we all go through. Um, Normative grief is really categorized by movement. Now, whether that movement is a little on the faster side or a little on the slower side, that's okay. It's really just about those milestones in grief. Maybe slowly putting one foot in front of the other. When we're talking about prolonged grief, we're talking about 10 to 20% of the grieving population that really feels stuck. The DSM defines this as after a year okay, when we have experienced a loss. And we want to really differentiate that these individuals in prolonged grief, the cornerstone of this is a deep yearning and longing for that loved one that really does not seem to change over time. They really feel that their entire being is still dependent upon that relationship. And that's when we start to talk about prolonged grief concerns. When we're talking about PTSD, we're talking about fear-based concerns, right? Which is different than a loss. We're also talking about an immediate fear response to a threat or a trigger, right? That eventually subsides. Where when we're talking about loss, we're talking about something that is more long-standing, a different process. When we are talking about major depressive disorder, we are talking about, again, sadness, a deep, deep, deep sadness, but that does not necessarily have the trigger of losing a loved one. And so I like to differentiate those in those three ways. Of course, there are many more nuances to those, but we want to be very careful as clinicians when we are dealing with more complex, long-term grief. And I know we're going to talk about it more in the session going forward, but prolonged grief training is something I would recommend every clinician look into, just so that you can really build your skills around differentiating normative grief from prolonged grief.
Yeah, thank you. And I'm so glad we're doing this training because it's not only just the baseline of grief, but I'm hoping that we can really dive really deep into this, and like tweak our tools into this. And I know you mentioned the DSM, which of course is, our go-to on diagnosis. Are there any other assessment tools or clinical indicators that you rely on alongside the DSM?
Absolutely, right? We always want to use evidence-based tools to inform our practice. And so if we're talking about depression, I really prefer the PHQ-9 as just a baseline measure, right? And what's nice about that is we can see changes over time if we're working with someone in the long term. In terms of PTSD, there are several measures. I think that, we're still as a community, as a mental health community, really beginning to crack the surface on PTSD and really study that more. But again, we want to use evidence-based tools for each of those, right? And prolonged grief disorder is a structured prolonged grief therapy is a structured therapy that has its own assessment tools, right? And so we'd want to be very specific about using those if we were assessing somebody for prolonged grief disorder.
Yeah, definitely. Thank you. And if you do have a moment, maybe gathering some of that information for us, and we can provide it to our audience. That way we have it as a list, to kind of double
Sure.
check we have those. Thank you.
My pleasure.
Um, and of course, we're talking about these overlaps, right, of things that we can see within our clients. So how is it that you approach these cases when our clients are meeting criteria for multiple conditions?
You know, I, in my practice, tend to come to things from a humanistic standpoint, very much so in the beginning, right? In order for our clients to trust us, in order for our clients to feel comfortable with us, one of the first things I often hear from a grieving individual is, I think I'm going crazy, and they're not. They're not going crazy. We hear a lot of that stigmatizing language all the time, right? And so we want to first and foremost let them know that they're human. Let them know that grief is a human process, a universal process, something we're all going to go through, that there is support out there for. We want to acknowledge their courage in sharing right? We want to be able to be present with them during this really difficult point in their lives. And
Yeah,
then
thank you.
once they have opened up and they have given more information, we may be able to sit back and say, well, how long has this been happening for you? What are you finding is the most difficult piece of this that you're struggling with? That then can help inform our practice as to, are we talking about normative grief? Are we talking about PTSD? Are we talking about prolonged grief? But that initial assessment, those initial 2 to 3 sessions are really important in gathering information.
Yes, definitely. And now, grief also, from time to time, can be a very traumatic experience, in which it's a traumatic loss, or there could be a prior unresolved loss, and we're dealing with grief again, right? So, how do you conceptualize the case and prioritize treatment targets or goals?
Sure. Well, we always want to be with the person in their individual experience, right? And so maybe there are several things happening. Maybe we are talking about, a traumatic loss that's compounded upon several other losses in the last few years. One of my first questions in those situations might be, what is presenting the most for you right now? We don't want to assume that just because maybe there was a violent loss that somebody needs immediate trauma treatment. We want to know, what is it about their life, about their grief, about their experience, their lived experience, that they feel is the most important to work through right now. And so we're going to let them tell us, right? We're going to let them lead in treatment. And we are going to then stay with them on their path. And so in complex cases, somebody may say to us, the loss was very violent, and very disturbing, but I am still thinking about grandma's loss, the death of grandma from 2 years ago. And I really feel like that's where I need to start, because we do know that losses can compound, right? And that maybe we haven't fully processed a loss from 3 years ago in this present time, right? And so we are going to stay wherever the client needs to stay, wherever they want to begin in the work.
Yeah, thank you. And this is also an important part of determining readiness in our clients. So how do you determine readiness or maybe unreadiness, to process this loss directly?
Sure, that's a great question. If somebody has already walked in the door, whether that's to um, individual outpatient therapy, whether that's to meeting with a grief counselor, whether that's to a grief support group, they've already shown some readiness, right? And we always want to acknowledge and commend them for that. We do not want to dig into things that a client is not necessarily ready to dig in with. And so it's important for us to respect, wow, maybe there is this really big loss right in front of us, right? In the room, in the work. But if a client is saying, I'm not ready to go there yet, um, it's important for us to differentiate, are they saying they're not ready to get into the conceptualization or the verbalization of that loss? Are they not ready to get into the emotionality or the physical responses to that loss? We're really going to come to that from a place of, tell me more. Tell me where that resistance is coming from. Tell me where you feel that resistance in your body. And we don't have to go any further if you're not ready to go any further. That can be something we get to in your own time. But that resistance is also telling us something, right, Bonnie? That is that resistance telling us that there's too much pain there? Is that resistance telling us that maybe there's a little bit of avoidance? That both pieces of that are really speaking volumes. But again, we as clinicians always want to stay where the individual is at first and foremost to protect them from maybe things that are perhaps a little too painful to start with.
Yes, most definitely. So thank you for sharing that because we want to keep in mind those open-minded um, questions for them to have that conversation with us and assess from there. Of course, there's some important parts with attachment,
Mm.
and where each individual is with their attachment. So, given attachment theory and grief response, how do you see the attachment styles shaping the way that individuals experience and express grief?
Attachment theory is significant in grief, right? We know this. Relationships are reflected in how we're going to grieve, right? And so, if we are talking about a secure, you know, compassionate, open ended, giving relationship, we are talking about a higher likelihood for healthy continued bonds, right, with that individual, which can lead to a lot of memory making, a lot of healthy rituals, feeling a closeness with that individual. And so, in a perfect world, everybody we talk to is going to have had, a secure attachment and feel very close to that individual. But in the real world, no relationship is without its challenges, right? And so, if we are talking about relationships that were perhaps a little more insecurely attached, or even more dysfunctional, including abuse or neglect or more severe aspects of a dysfunctional attachment, we are going to start watching for a higher likelihood of prolonged grief. And or we may then start talking about PTSD. We're just going to be aware that those attachments inform somebody's ability to grieve and move through those milestones. And that's going to raise our awareness around, well, this attachment, is going to inform how they can grieve and move through milestones in grief. And so that may then lead to having more conversations around the relationship and maybe what needs to be resolved for them in that relationship to strengthen their ability to move through their grief. I do want to mention one of the books on grief and attachment that I really love is Attachment Informed Grief Therapy, and that's by Phyllis Kaminsky and John Jordan. I do recommend that as a read for all clinicians. It's really a great way to familiarize yourself with the importance of attachment theory and grief therapy.
Yeah, thank you so much for sharing that with us so that we can look into that and hopefully read it to further our, um, you know, education on this and better serve our clients here. So thank you for also mentioning kind of those interventions that we want to take based off attachment patterns and being well aware of it because it does have um, can take an aspect as far as how someone will deal with it or understanding someone from that chair. Of course, we do that biopsychosocial, so we have information on their history. So considering that as well. As far as the relationship from the clinician and the client, what role does a therapeutic relationship play as a corrective attachment experience?
Bonnie, before we get into that, I do just want to let you know that my screen is still showing me the original slide, and you did want me to mention that to you if it was stuck. So
Yeah, thank you. We can
you're welcome.
This will be the next one. So we can stay on that one as well. So these will just be the two in the background. And then as we continue to talk, and then towards the end, we'll do the resources and the thank you.
Sure, great.
Yeah.
I'm sorry, could you repeat that for me?
Yeah, and we'll go ahead and go from there. So, what role does a therapeutic relationship play as a corrective attachment experience in this?
That's a great question, right? Um, I often find in previous practice, because in current practice, I'm doing a lot of counseling and education and not so much intensive grief. But in more intensive grief work, I was often using the empty chair practice, right? And so that's a practice that again is relational and about attachment. And we can see often that our clients really need to be able to have that time and space to express things to a loved one that maybe is no longer here that are really difficult to say. Maybe there were things left unresolved. Maybe there were things left unsaid that are painful and that they are still carrying around that really contributed to some insecure attachments. Um, on either end of the relationship, right? And so we serve, right, as a vessel, really, I think, in that practice where maybe we need to show almost a pseudo presence in which we are the conduit for an individual to process unresolved needs or concerns through us in helping resolve their emotional attachments or bonds with that individual.
Yes, definitely. Thank you for sharing that incredible tilt there, the empty chair. Um, in cases of traumatic loss, how do you balance the traumatic processing with grief work and keeping in mind not overwhelming the client? Because these are really strong emotions that can come forward.
Absolutely. And so we want to be very mindful of grounding and mindfulness practices, right? So I often would provide early on in the work um, beginning awareness tools of right checking in with our bodies, right? Where is our breath, right? Is it short? Is it shallow? Um, are we present in the moment? What do we need to be present in the moment? Is there for example, a safe tool that if we're holding on to might help to ground us and help us feel safe enough to do the work in the moment? Um, a lot of physical grounding practices can be helpful to ascertain whether or not somebody's ready to somebody feels supported and safe enough to dive into the work. Readiness is an ongoing process because, like you said, when we're talking about trauma and we're talking about grief, those are really deep needs. We have to be very careful with our individuals in that work because we don't want to take them to a place where maybe they're not ready. So the beginning start of that work is helping them to assess, what comes up for my body when I even think about revisiting some of these things, revisiting some of that trauma, revisiting some of those losses. Um, can I be present? Can I still be aware of my breath? What's coming up in my body? Are my shoulders all of a sudden at my ears? Um, just starting to help individuals build that awareness and readiness, and giving the tools for being able to stay present and safe in the moment, really answers the question of are we even ready to start to unpack some of that. When individuals do feel that they have enough tools, maybe through grounding or mindfulness work, to say, okay, I am ready to revisit that. We want to be continually checking in with them. right? So if we are in the middle of supporting an individual processing a previous loss or a traumatic event, we want to be constantly checking in. What's happening for you right now? Are you still here? Are you still feeling safe in the present with me? We want to be observing body language. We want to be observing breath. We want to be acutely aware of changes in the space, which I think most clinicians, really are, right? That's our job, is we notice changes in body language. We notice when somebody's feet are not on the floor. We notice when there's a twitch or a change in facial affect. And all of those cues are really important when we are sitting with someone who is potentially starting to process some really deep, heavy grief and or trauma work.
Yeah. Are those also some things that you notice in the client becoming dysregulated, versus avoidant? And can you specify some of the things that you notice for your clients on dysregulated versus avoidant?
Absolutely, right? And so that is exactly what you just mentioned. It also can tell us, those cues very much tell us, is somebody dysregulated at the moment, right? Are we on the same train of topic that we are talking about? Or have we kind of checked out of, well, I was talking about how this feels for me, and now I'm talking about something more cognitive based, right? I'm more in my head, kind of recounting maybe obscure details rather than what the emotional process was for me or how I was feeling in that time and present. One of the things that I have seen that maybe, tends as a clinician for me to raise a little bit of a flag, is if I ask a question related to emotionality or how someone is feeling, and then they start to talk about, maybe more abstract, um, unrelated details, right? And maybe that tells us that there's something there that they are not ready to dig in. Maybe we are a little more dysregulated at this point. Um, Fast, rapid speech, being tangential, uh, really just not being able to be present. Uh, and eye contact is a big one of those, right? That's a big indicator of whether or not somebody is present in the moment. Um, Avoidance of emotionality, avoidance of emotional words, not being able to check in with somebody's body. I don't know, I'm not feeling anything. Numbness, right? That might indicate more of a dysregulated state as well.
Thank you so much for mentioning that so that we can keep that close eye specifically on some of those things.
Yeah.
Now, do you incorporate modalities like EMDR or somatic approaches in some of these cases?
Absolutely, right. So I am trained in EMDR, but I am not certified. So I do not practice because that would be unethical. I do incorporate pieces of EMDR that individuals are ready for and or interested in, right? I think the majority of us would say that butterfly tapping is a great tool for regulating, right? Anytime we can stimulate both sides of the brain in a safe way, helps helps us be more present, be more mindful, can be a great way to begin more intensive work, right? Those tools that help us check in with our bodies. And it's so much more than deep breathing, right, Bonnie? For some individuals, it may look like stretching. For some individuals, it may look like some yoga poses. I've absolutely been on the floor of an office with clients, maybe in child's pose. which is, again, a somatic practice, a body-based practice that we really want to be able to give those tools to our clients before beginning any of this work. I have found that somatic practices can really, really be very supportive before any kind of intensive grief processing or trauma processing. I'll often invite someone with me, maybe to stand up and put a big stretch into the air. I really appreciate the usefulness of somatic practices and the tools from EMDR, right? Just the fact that EMDR really focuses on bringing our whole brain into the process, safety in the present, in this moment. Um, I love butterfly hug. I appreciate tapping and or other tools around movement that again can help a client regulate in the moment and be present. You can get really creative with the tools of EMDR and somatic practices to help someone, with their readiness and their ability to sit in their body and figure out what feels good for them and where their physicality is in the present.
Yeah, thank you for sharing that. I always use the butterfly hug a lot, especially when it comes to children with that experience there, but it can be so beneficial for our clients,
Mhm.
again, with that loss and grief of a person and giving yourself that love, care, and even just the pressure in itself as well and sitting with it. So thank you for sharing that.
Absolutely.
I know you specialize in disenfranchised grief. So can you specify and kind of elaborate with us when a client's loss is not validated by their emotional um, their social environment, right? How do you approach this?
Sure, right. And, we saw a lot of this during COVID, right, Bonnie? Um, a lot of us had losses that we were not able to publicly mourn. And that's when we're talking about disenfranchised grief, right? Because we know as a species that we don't exist in a vacuum. We don't do well that way. We don't do well in isolation. And particularly in grief, we need community. And so, again, a lot of us professionals are acting as a conduit to help validate and normalize that loss for an individual. We also may do some really good research around other supports that are out there. Um, I was recently working with an individual from the LGBTQ plus community, and while they were wonderful in taking advantage of our short-term grief counseling, they also were really interested in their own experience and their lived experience, and asked about a specific group for loss of an LGBTQ spouse, right? Because they have a lived experience that is different from perhaps the normative or typical lived experience, and they deserve to be able to share with others who can identify and relate to those experiences. So perhaps if we're talking about an individual with more of a disenfranchised grief experience, we want to look outside. We want to start exploring the communities at large around us. Is there a specific support group for this kind of loss? Where can we help this individual find others who maybe has experienced this type of loss, and how can we get them connected?
Definitely. And in this, sometimes I would think you run into these systematic or cultural barriers, right? Which do you notice that barriers do you see most often?
Hmm, that's a really good question. I'm going to have to say, I think systematic. One of the things we talk about most often in grief and loss is the after tasks, right? And the secondary losses of roles. Um, and the fact that our society is not set up to support grieving individuals. You know, part of the reason this conversation in and of itself is so important is because we still live in a death denying society. And mental health professionals are raised in that, whether we have looked at that yet in our education and experience or not. It's really important that we do, because we are going to sit with individuals who are trying to complete the after tasks of loss, right? Um, concrete concrete issues, right? How many days do I get off from work for this loss? How can I afford to pay my bills after this loss? You know, um, do I have to spend a whole day at the Social Security office? You know, who's going to support me in answering these questions? And so collectively, the systems that we function in often are not supportive for individuals who are grieving, right? They create more barriers. Um, we often help individuals navigate delays in receiving a death certificate, which then creates delays in receiving maybe financial means that they need. For example, there are many, many more, right? Navigating the healthcare system alone, trying to get records, those kinds of things can be very difficult. And so we're helping individuals to navigate a system that often creates more barriers than it does offer supports to grieving individuals.
Yeah. And it's so important for us to be aware of, alongside the grief that they're feeling and moving through, all of the things that need to get done per se, and who does that lie on? Is that on them or is it another family member? And the stress that comes along with it. Because yeah, there's definitely lots of things that need to be done and the effects that it has on life. So thank you for
Exactly.
mentioning that.
Yes, and where can they find support in those tasks?
Yes. How do you facilitate meaning making in grief without imposing a narrative or rushing this process for the clients?
Absolutely. That's a great question. And so, one of the most simple and inviting ways to begin to do that kind of work with a client is to ask if they would like to tell you about their loved one, right? Sometimes it can be really easy, right, in our work to get kind of focused on solutions and fixing. Um, and of course all of that is important, but if we take a step back, right, this work in grief is human based, and we want to know who that individual was for the person sitting in front of us. We want to be there to listen to what were their favorite things, what were your favorite things to do together. Tell me the memories that have been coming up for you. If you'd like to share those with me. Storytelling can be so significant in beginning to move, through the grief process, and beginning to obtain some of those milestones. And we can really support someone in just simple questions around, you know, tell me about this person. Tell me your experiences with them. Tell me who they were for you.
Yeah. And now when it comes to children,
Mhm.
and the conversation around this, how do you adapt grief interventions across developmental stages, particularly when working with children who might lack this um,
Yeah,
ability to communicate it and express their loss?
yeah, that's a great topic, Bonnie, right? So I tend to separate those for myself in terms of early childhood and later childhood, if we're talking on a broader spectrum, just for today's, experience. Um, And for me, the age point I like to differentiate is around the age of 12, right? Because less than 12, we're in general talking about children who do not have the ability for abstract thought, right? And so we're talking about kiddos that death is still kind of this mysterious concept. Kiddos under this age range may at points think that, death means that their loved one is going to come back. Um, Without abstract thought, it's really, really hard for our brains to understand that death is permanent, is a permanent state. And so this is the age group where they may need a lot of repetition. And that can be really difficult for caregivers, which is why I always get really excited when there's a kiddo in my office because parents recognize that, you know, they may need more support in um, helping to reiterate this process for a child, right? You know, there may be only so many times in a day that another parent can say to a child, well, daddy died and he's not coming back. But unfortunately, kids in this age group, and this can be very difficult for adult caregivers, really do need that repetition at points. And so, again, in this age group, play is one of the most powerful tools that we have. Play is learning for children. And I may have just quoted Mr. Rogers there, but play is learning for children, and play can be really powerful in helping kids process their grief, right? So with younger kiddos, we really are wanting to use hands-on tools, whether that's pretend play. Do we want to talk to daddy on the telephone? Daddy's in heaven. Whether that's more hands-on, I need to process some of my big emotions by pounding Play-Doh to start to talk about this or gain language around I'm angry or I'm sad. Um, Maybe that's, books are my favorite for younger kids, right? Because it also can help with that repetition that maybe they need to understand the permanence and start building memory making. Um, One of my favorites is The Memory Box. I hope you can see that. It is by Joanna Rowland, and it is a book about grief for younger kids. Part of what's so great about that book in particular is that it's twofold. We are giving language around loss, but we're also giving the beginnings of memory making, which can be a really powerful tool for kiddos. When we're talking about older children, right, children who have developed the ability for abstract thought and maybe have more language, that 12 to 19 range, we want to uh, um, allow them again to be where they're at. We're really starting to talk about younger adults, so to speak, in a way. And we want to very much start to normalize this for them. We want to let them know that they're not alone, right? We want to help them get connected with other peers that maybe have had a loss. Um, it's springtime now and summertime is coming. And in the professional grief world, we love summertime because summertime means grief camps. And there are several out there, not just my organizations, but a lot of hospices around the country offer a children's bereavement camp, which can be a great way to start to um, help older kids connect with each other in that, I'm not alone in the fact that I've experienced a loss. Teenagers are one of my favorite populations to work with in grief because they are at higher risk for complicated grief because not only are they navigating a loss, they're navigating changing hormones, they're navigating peer pressure, right? 13 to 18 is one of the higher risk ages when they experience an immediate loss, of a parent or a sibling. And so as clinicians, we want to be aware of that, right? We want to know that grief is not just a concept that they need to understand and be able to process. They're processing it in this larger context of peer pressure and hormonal changes and figuring out who they are and the pressures of school and education now too. And so we want to be able to engage them when and where they're ready to talk about their loss, which again, in that age group, we know um, the importance of peer relationships for them. And so anytime they can get connected to others in their age group who have also experienced a loss, that tends to be where we start to see connection and success and coping and resilience.
Definitely, especially with that social connection. And of course, for their age and stage of development is so important. So thank you so much for sharing that for us to keep in mind there too. With this, we did talk about roles a little bit earlier. And even in this, right, we're talking about developmental age and stages. So of course, this goes along with adults as well. So how do you navigate situations where family members are grieving differently? Um, and this could be like leading conflict into where it's coming up, or even disconnection within family systems.
Sure. Yeah. And working within the family system when there's been an immediate loss um, can be very heavy work, right? Because everybody does grieve differently. Everybody does. Um, and we want to offer the ability for a family to come together in that if they're ready to do that. And so family sessions can be helpful and powerful in that, because what I find is usually the most successful in those early family sessions after loss is really teaching active listening skills. Right. We want to be able to help each family member hear each other, right? And hearing as in hearing to understand and not to respond, right? And so teaching those listening skills of clarification, of open-ended questioning, of really uh, empathetic listening can help a family increase their communication around how they're feeling for each individual, um, and be able to help each family member have their own individual process um, in still figuring out functioning after that kind of a loss. Grief can be very isolating when we don't feel like we've been heard and or understood, especially by those who are the closest to us, who are immediate to us, right? um, and helping family systems navigate that, in just being able to have each member be heard in where they're at can be a great starting point to reducing family conflict and dysfunction afterwards. Um, are we doing immediate problem solving because roles have changed so significantly that that's what's creating conflict? Or are we trying to figure out how to emotionally process this together in that there is no right or wrong way to feel in grief, and helping each family member understand that? Where are we really beginning with this family in their grief?
Yeah, thank you so much for sharing that. 'Cause we do need to consider the individual as well as, them as part of their systems as well. So thank you so much. Now, of course, as I mentioned a little bit earlier, we as clinicians are human, and you mentioned that grief is a human experience, something that we all go through at some point. So what are some ethical dilemmas that arise in grief work, particularly around boundaries, self-disclosure, or even prolonged treatment?
Absolutely. And this is an important topic, right? And so, for any student that I've ever had or worked with in grief work, one of the first things I really encourage is for them to evaluate their own family's culture around grief and loss, right? Where is your own individual comfortability and where does that lie? Was death normalized growing up, right? Were you invited to participate in rituals or no? Was death a taboo subject? You know, um, should Aunt Mary have been over it in a month kind of theme, right? Where were your own themes growing up? Where was your own comfortability with death and loss? I think it's important for all human service professionals before coming into this work to really sit with our own stuff, and decide, do we have stuff maybe in our own personal losses that we have not really worked through, because we shouldn't be sitting with a grieving individual if we have our own stuff, because when we have not resolved our own stuff, there's probably a higher likelihood that we are going to be triggered in that work, right? And so, well, this is human work, and well, we do want our clients to feel safe and comfortable sharing with us um, what we share about grief, particularly our own experiences. The first question really has to be, am I sharing this for their benefit or for mine? And if the answer is this is for me, then you probably have some more work to do, right? Because we have to be very, very careful in that work. There is a line. Grief is universal, and we can connect in that universality and that humanisticness that grief provides. Um, but if we're working with someone and we're beginning to share intimate details around our own losses, that's really when we're probably there may be an ethical issue there. There may be a boundary issue there that says that maybe we need some more supervision or we have some more work to do around our own losses, right? And
Yes,
so it can be tricky work.
yes. And of course, as we practice, it's something that we can experience coming up like within the future or in the moment. So going back to what you had mentioned too, understanding that sometimes our systems are, aren't built for it, right? I would like to think that our own systems in the clinical practice are built a little bit better for it, but it depends on where you are practicing, maybe in a bigger um like company or program to where there's lots of services being provided, right? And so again, our systems aren't built for grief and understanding you showing up for your client in the well that you're prepared for, um, to serve them and understanding where they're from as well and their system not working in grief, right? So thank you so much for sharing that. I'd like for us to kind of wrap up here with your clinical perspective here. How has your understanding of grief evolved, and how has it changed the way that you practice?
Wow. I have been doing this work, goodness. In my graduate program, we were given a choice to kind of differentiate between clinical mental health practice or death and dying. Um, and I will never forget sitting in Dr. Monastero's death and dying class and just falling in love with somebody finally talking about this big thing that we all go through. Although I will share that I grew up in a family that did normalize death and dying and grief and loss. And I participated in rituals as early as 6 years old. And so I've always kind of had this privilege, right, of knowing that this is something that happens to all of us, and that we can talk about it and we can explore it. Um, and then coming into school, right, and learning that not everybody did, not everybody does, that it is a taboo subject, um, and learning more about systems and barriers, right, to healthy grieving. Um, wow, the work evolving. And I think the work evolving really starts with ourselves, right? And so having really, really terrific supervision in my first years as a hospice social worker and my first years as a grief counselor made all the difference in the work evolving, right? In the work becoming something that you can sit with, something that even if something comes up for you in the moment, you know that there's somewhere you can take that safely later, right? So that it's okay because we're human and things are going to come up, but we um, have safeguards in place to know that we're not going to harm our clients in the work because we have unresolved grief or we don't have the supervision that we should have, right? And so, one of the most important things I think in this work um, for it to evolve for each of us, right, and help us grow as clinicians is one, to have excellent supervision, to make sure that your supervision is ongoing, right? To make sure that your research is ongoing. We want to stay current in the field. We want to know what's happening. We want to be certified in prolonged grief therapy, and we want to know about attachment theory and tools and mindfulness and grounding. And then finally, we need to create our own self-care rituals. And I have a lot of feelings about the term self-care, but that's the only one I have right now, that term itself. So that's the one I'm going to use, because that's not always simple when you're maybe a full-time working parent as well or such, right? And we talked a lot about systems and barriers. But if we are going to do this work well with grieving individuals and we are going to evolve as clinicians, we have to make sure we are taking care of ourselves first as well.
Thank you so much for sharing this really insightful information because grief, again, is something that we are going to have our clients experience, and we want to help them work through this. So I hope that this hour training will help you differentiate between these layers that they could be experiencing, and differentiate between all of them, as well as applying these evidence-based practice of different interventions that you can utilize, as Jennifer shared, really great tools, and of course, like the book, as well. And lastly, of course, evaluating your client's progress. And we'll share these materials with you so that you can evaluate from beginning to the progress that they're making and towards the end and share that with them as well and see the progress that they're making alongside there. And again, it is a human experience, so I hope that we can take this with us for our clients and for ourselves as well to show up the best that we can here. So thank you so much, Jennifer, for all of your great information here. Some resources, of course, our DSM, and we'll be sharing some tools with you alongside this course as well. But thank you for sharing your clinical insights with us, on grief and all of the layers behind all of this.
Thank you, Bonnie, for having me.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.